Hey everyone, it's Adriana, and today I will be coming to you to discuss feeding in infants with cleft lip and palate. Cleft lip and palate is a common facial and oral anomaly that affects 1 in 700 babies each year. Cleft lip and palate can be described as an opening in the roof of the mouth and or a split in the lips. Cleft palate can range in severity and it can range in location. You can have a unilateral or a bilateral cleft. Cleft lips and palates develop when the tissues that make up the lips and palates do not fuse together properly before birth. There is no known etiology of cleft lip and palate. However, it may be due to both environmental and genetic factors. One of the biggest problems associated with cleft lip and palate are the effects it has on feeding. This occurs as a result of reduced sucking ability, nasal reflux of food and liquids, and too much air intake. There are several devices and interventions that have been researched in regard to infants with cleft lip and palate. One of the most common devices is the feeding prosthesis. This is usually the first plan of treatment that is recommended after birth due to immediate nutritional needs of the baby. A feeding prosthesis is a device that serves as a feeding plate that covers the palate opening. This helps to separate the oral and nasal cavity as well as it helps to generate negative intraoral pressure that is needed for successful sucking. This prosthesis is formed from using various materials to make custom maxillary impressions of babies' palates. Breastfeeding is usually always a recommended form of feeding for infants, and that is no different for babies who are affected by cleft palate. For mothers of babies with cleft palate who are breastfeeding, it is extremely important that they receive instruction on how to safely and effectively feed their babies. Many techniques include specialized positioning of the mother. It is important that feeding positions ensure that the baby is not getting in air and only milk. Two of the most important and researched effective positionings for the mother is the modified football hold, as well as holding the baby at a 45-degree angle. Lactate is also a program that can help the mom control the amount of milk that is entering the baby's mouth. Nipple shields made of silicone are also used to help create greater skin to skin contact, which we know helps to strengthen the bond between mother and child. There are several specialized equipment options for babies with cleft palate. These options range in size and shape. They come in the form of bottles, nipples, cups, and spoons. There is no one standard for every baby with cleft palate. However, many studies support the use of compressible bottles because they allow caregivers to control how much milk comes out at one time and how quickly it comes out. Feeding techniques can vary from baby to baby. It is important that caregivers use feeding techniques that are the most safe for their baby and increase feeding success. One technique used is the enlargement, stimulate, swallow, and rest technique, also known as ESSR. This technique involves enlarging the nipple hole, stimulating sucking from the baby, waiting for the baby to swallow, and watching the baby during rest. During rest, you're watching the baby to determine if the baby is ready for more milk or maybe if the baby needs to be burped. Overall, evidence-based practice shows that with intervention, oral feeding can be successful for infants. These interventions should ease stress and anxiety by the family, promote the baby's growth and development, as well as assist to facilitate normal feeding patterns. That's all, you guys. My handout will be below. And if you have any questions, Let me know. See you later.